So is the room spinning, or are you experiencing a really profound, frankly terrifying loss of balance? Look, if you've ever had vertigo, you know exactly what I'm talking about. It's this overwhelming sensation that can leave you feeling just completely out of control. But hey, here is the good news. The spinning isn't some unsolvable mystery, and it's definitely not something you just have to grit your teeth and live with. It's actually a specific mechanical or neurological signal. And today, we are going to decode it together.
Welcome to this explainer. I'm going to be acting as your guide today. Basically, think of me as a doctor prepping you for your very first big specialist appointment. We're going to completely demystify your dizziness so that when you walk into that clinic, you aren't just a frightened patient. You're going to be an informed partner in your own healthcare, completely armed with the exact data your doctor needs to get your balance back on track.
We've got a really clear, structured agenda today to help lower your anxiety. We'll start by ruling out the scary stuff, the emergencies. Then we'll figure out your inner ear mechanics, look at symptom comparisons, and finally, give you some concrete home exercises and a checklist to take right to your doctor.
Let's dive right into Section 1, Urgent Neurological Red Flags.
Okay, listen, while most dizziness is totally benign, we absolutely have to know what a severe threat looks like right off the bat. See, your inner ear controls balance, sure, but so does the back of your brain. If your dizziness hits out of nowhere and brings along neurological signs like slurred speech, double vision, or suddenly you can't walk straight, do not wait for a clinic appointment. Call an ambulance immediately. These can be atypical signs of a posterior circulation stroke. When it comes to this, time is brain tissue. See these red flags? Take immediate action.
All right, moving to Section 2, crystals versus fluid buildup.
If you don't have those red flags we just talked about, take a deep breath. You are very likely perfectly safe. Your inner ear is this incredible piece of biological engineering, but it really has two major points of failure. On one side, we've got a physical debris problem, literally tiny rocks floating where they shouldn't be. On the other side, it's a microscopic plumbing issue, too much fluid creating extreme pressure. Let's break these down.
First up is BPPV. That stands for benign paroxysmal positional vertigo. Deep inside your ear, you have these tiny calcium crystals called otoconia, and they actually help you sense gravity. Pretty cool, right? But in BPPV, these calcium crystals break loose. They physically float into your fluid-filled semicircular canals. So whenever you change positions, like rolling over in bed or maybe looking up in a high shelf, these rogue crystals tumble around and send a false, "whoa, we're spinning" signal straight to your brain. On the flip side, we have Meniere's disease. Now, unlike BPPV, Meniere's isn't caused by loose rocks. It is entirely driven by abnormal fluid dynamics. Basically, a buildup of fluid creates intense pressure inside the ear. And because your hearing and balance organs share this exact same fluid pathway, this pressure doesn't just make you dizzy, it physically affects your hearing structures. That's why you might get ringing in the ears or feel like your ears totally clogged up or underwater.
Let's look at Section 3, comparing your vertigo symptoms.
Knowing the mechanics is great and all, but how do you actually know which one you have? Notice the dividing lines we've laid out here. BPPV, it usually lasts only seconds to a minute and is strictly triggered by head movement. Absolutely no hearing loss. Meniere's, however, can last for hours, hits totally unpredictably, and directly impacts your hearing with that ringing and fullness. And a stroke? Sudden, continuous, and usually brings along those scary neurological red flags. Definitely take a mental snapshot of these criteria because this is exactly how your doctor is going to evaluate you.
Which brings us to Section 4, vestibular exercises at home.
Okay, now that we understand the mechanics and the symptoms, you don't have to just sit there feeling miserable. You can take action. This first home-based exercise is called gaze stabilization, or the VOR exercise. Its whole purpose is neuroplasticity, literally retraining your brain. By focusing on a target, like maybe a letter on a wall, and turning your head while keeping your eyes locked on it, you are purposely but safely provoking a little mild dizziness. Over time, this actually forces your brain to adapt, tolerate the dizziness, and sync your eye and head movements back up.
Now, if your symptoms are pointing toward BPPV, this next one is absolutely for you. The Brandt-Darraf exercise is a physical maneuver. By sitting on the edge of your bed and rapidly lying down on your side, you are actively trying to flush out and float those dislodged calcium crystals right out of the wrong part of your inner ear. You wait 30 seconds for the fluid to settle, sit up, and repeat. It's quite literally a mechanical fix for a mechanical problem.
Let's move to Section 5, diet and lifestyle adjustments.
But hey, what if your vertigo isn't loose crystals? If your symptoms align more with the fluid buildup of Meniere's disease, you can't just shake the fluid away, right?
Your daily defense has to start here. Consuming too much salt, caffeine, or alcohol makes your body hold on to water, and that directly worsens the pressure inside your inner ear canals. By keeping your sodium under 2,000 milligrams a day, staying consistently hydrated so your body doesn't panic and hoard water, and managing your stress, you are actively draining the pressure that triggers those awful Meniere's attacks.
Finally, Section 6, your pre-appointment patient checklist.
We've covered the emergencies, the mechanics, the exercises, and the diet. Now it's time to prep. A doctor is basically a detective, and they need evidence. I highly recommend grabbing a notebook or taking a screenshot right now and copying this exact log template. Use it every single day to track your diet, your stress levels, and crucially, the duration and exact triggers of your symptoms. Did looking up at a shelf trigger a 10-second spin? Write it down. Did a super salty meal trigger a 2-hour dizzy spell? Log it. I promise you, this data is pure gold for your doctor, and it will absolutely fast-track your diagnosis.
Next up, you want to bring this checklist of specific questions directly to your doctor. Please do not just settle for a generic, "yeah, you have dizziness" label. Ask them, do you think it's central or peripheral? Ask if they can do the HINTS test. It's this highly sensitive eye movement exam just to absolutely rule out a stroke. Ask which exact physical maneuver or rehab therapy you need. Firing off these questions shows your doctor you are serious, you're informed, and you are ready to do the work.
And that brings us to our final thought for today. Remember, while the spinning is incredibly frightening, you now have the structured data and the fundamental understanding to actually partner with your doctor and take your balance back. So I want to leave you with this question to chew on as you prep for your appointment. Are you just going to wait around for the next spin to happen? Or are you ready to decode the signals your body is sending you and firmly step back into the driver's seat? Thanks so much for joining me on this explainer, and hey, here's to finding your balance.